Technology has developed a new non-surgical spinal treatment system called antalgic trak. Only the new antalgic trak system provides doctors with advanced treatment tools that eliminates pain without surgery. Experience the most technologically advanced non-surgical spinal decompression system. For your free, no-obligation consultation and information describing antalgic trak's innovative treatment, call the number on the screen now.
My medical condition is I have 2 herniated discs in my lower back.
I have 2 herniated discs, one the L4-5 disc and the other the L5-S1 disc.
I have scoliosis and also was recently in a car accident.
Well, the last 2 years I had cancer of the bladder and I took chemo, and chemo softened up my backbone. And
the accident that caused my injury to my lower back affected my whole life, personally and professionally, in my ability to walk and do everyday normal tasks.
It happened as a result of a lot of contact sports that I played throughout childhood and high school in particular.
I could no longer bend over to open the dishwasher. I could no longer carry laundry down the stairs. I could no longer play baseball with my kids in the backyard.
My case is not severe, but of course I've had some pain associated with it for years and it was undetected.
Running is very painful for me. A lot of the stretches involved just in any sport is difficult for me. Even just like waking up, like getting out of bed in the morning, standing up from sitting down, any change of position can generally throw out some pain. So it really has a big impact on the way I live my life.
Dr. Ray recommended no medical drugs.
the decompression is the only thing that's probably would have helped me.
It just makes it a little bit easier to get out of bed. There's a little bit less pain each day. It's a little bit easier to run if I want to, play a game, pick up football with friends.
I lead a very active lifestyle. I teach, sing, and model, and so obviously I need to be as pain-free as possible.
Today, 10 months later, I don't have a pain in my body.
Between treatments, my neck is better extended and I have a lot less pain.
At this point, I've used the machine 20 times and have had a decrease of about 80% of the back pain that I have.
Thank you for taking the time to watch this important and informative report of findings and treatment orientation brought to you by this Antalgic Care non-surgical healthcare office. Your doctor has asked you to view this video so that you will clearly understand how new breakthroughs in range of motion decompression therapy are going to be applied during your treatment sessions. What causes back and neck pain? Two of the most common reasons are strenuous activity and repetitive activity. They are precursors to back problems that can create a multitude of injuries. A third reason is limited movement of the spinal joints or fixated spinal vertebrae. Spines with limited or fixated joint movement are more prone to injury, even while performing the simplest activities. All these everyday activities strain and sprain the spine and can cause injury to the disc and surrounding tissues. Understanding the spine's anatomy. To understand the disc, let's review its basic anatomy. Like a jelly donut, the spinal disc is a similarly structured unit. It is comprised of an outer cartilage border that surrounds and contains an inner softer gel. The outer cartilage border is called the annulus fibrosus, and the inner softer gel is called the nucleus pulposus. As vertebrae move, they exert repetitive load pressures onto the disc. When the disc becomes overloaded or over-squeezed, these extra pressures begin to weaken the disc's outer cartilage wall. The job of this wall is to keep the inner disc gel safely inside the disc. The weakened wall can allow the disc's inner gel to bulge outward or herniate beyond the outer wall and onto neighboring nerve roots. This causes debilitating pain. Most patients will not see a doctor until their disc is producing damaging pressure on the nerve. Current treatment methods. Current treatment methods include spinal epidural injections, drugs, chiropractic, nutrition, acupuncture, physical therapy, exercise, or surgery. When a patient chooses surgery, the procedure attempts to shave, burn, or cut away the expanded and bulge disc material that's pressing on or pinching the nerve. These surgeries are risky and often don't produce a favorable outcome. But now you are about to experience a new breakthrough in therapy called antalgic trak range of motion decompression. Range of motion decompression can only be performed on the antalgic trak. Antalgic trak is a new FDA-cleared Class II power traction medical device. For many, it can minimize or even eliminate the need for dangerous surgical procedures, needles, and harmful drugs. Antalgic trak is a specialized and computerized spinal decompression system that's designed to gently unpinch nerves. It works by slowly and gradually increasing and improving the disc spacing between spinal vertebrae. Antalgic trak's exclusive range of motion feature is the only system currently available that can strategically position the spine during decompression. And because range of motion is essential for spinal health, combining it with decompression provides an even greater treatment outcome than either therapy alone. This combined range of motion decompression technique has been named Kinetic Decompression Mobilization, or KDM. It is the most advanced decompression treatment system available today. KDM consists of a series of systematic, rhythmic, and gentle movements that improve decompression's ability to target specific areas within the spine. This results in a more effective system. Getting treatment. The Antalgic Care non-surgical centers are the only healthcare facilities currently available that can provide antalgic trak's range of motion spinal decompression. It's the only system in the world that can strategically position your spine to target and move the decompression pull forces into, around, and through the disc. This enhanced positioning improves where and how the decompression pull forces are focused and moved through the spine. More importantly, this improves the spine's ability to retract the bulging disc off the nerve and back into its pre-pressured border. And for you, as a patient, that means relief. Patients that are accepted into the Antalgic Care KDM program understand that the treatment goal is to remove their pain and to ultimately normalize the dynamic mechanical functions of their spine. Scheduling care. Studies on decompression concluded that a series of closely scheduled sessions produce the best results. Although no health facility can guarantee results, it is logical and recommended to follow the established protocol. It is extremely important that you attend all your scheduled treatment sessions in order to maximize your treatment outcome. Patients must do their part and comply with the treatment guidelines and recommendations specified by their doctors. These closely scheduled sessions also develop an essential treatment momentum. Momentum creates and provides physiologic and anatomical changes that are required to treat all the vertebrae, discs, and nerves, as well as muscles, tendons, and ligaments. Momentum can only be established by closely scheduling your visits. You should also know that antalgic care is not continuous, ongoing care. Its objective is to deliver effective, lasting results in a defined and reasonable time frame. Average programs are between 3 and 10 weeks. What's next? Now that you understand scheduling and momentum, before your care can begin, we'll need to lock in your group of appointment times. To do this, appointment times need to be reserved. You can reserve them by pre-purchasing them. In other words, the prepayment of scheduled time enables our office to reserve and schedule uninterrupted antalgic trak time over a prescribed period of time. It is very important to understand that your time is your time. and will not be given to anyone else. So please make every effort to attend all your sessions. This antalgic care non-surgical clinic will also provide you with all the necessary tools that you'll need to educate yourself on the KDM technique and the many wonderful benefits of the antalgic trak. This ends the video component of our report of findings presentation. We appreciate you taking the time to listen and learn about spinal health and how the antalgic trak can treat and rehabilitate your spine. In a moment, your doctor or therapist will return to discuss the particulars regarding your specific condition. This includes reviewing the details of your new treatment plan and a discussion on additional modalities or procedures that may be used in conjunction with your antalgic care program. We also want to say thank you for putting your confidence in us. We will do everything in our abilities to restore your health and to make you feel that your choice was the right choice. We look forward to our new relationship. Thank you again, and we'll be right in to speak with you. This program will reveal everything you need to know to make the important decision to have antalgic trak non-surgical neck and back care. Antalgic trak is a revolutionary device that's ready to alleviate neck or back spinal pain problems. If at any time you wish to speak to someone personally, simply call the local number provided, and our dedicated experts will gladly answer any questions you may have.
My medical condition is I have 2 herniated discs in my lower back.
I have 2 herniated discs, one the L4-5 disc and the other the L5-S1 disc.
I have scoliosis and also was recently in a car accident.
Well, the last 2 years I had cancer of the bladder, and I took chemo, and chemo softened up my backbone. And
The accident that caused my injury to my lower back affected my whole life, personally and professionally, and my ability to walk and do everyday normal tasks.
It happened as a result of a lot of contact sports that I played throughout childhood and high school in particular.
I could no longer bend over to open the dishwasher. I could no longer carry laundry down the stairs. I could no longer play baseball with my kids in the backyard.
My case is not severe, but of course I've had some pain associated with it for years and it was undetected.
Running is very painful for me. A lot of the stretches involved just in any sport is difficult for me. Even just like waking up, like getting out of bed in the morning, standing up from sitting down, any change of position can generally throw up some pain. So it really has a big impact on the way I live my life.
Dr. Ray recommended no medical drugs.
the decompression is the only thing that's probably would have helped me.
It just makes it a little bit easier to get out of bed. There's a little bit less pain each day. It's a little bit easier to run if I want to, play a game, pick up football with friends.
I lead a very active lifestyle. I teach, sing, and model, and so obviously I need to be as pain-free as possible.
Today, 10 months later, I don't have a pain in my body.
Between treatments, my neck is better extended and I have a lot less pain.
At this point, I've used the machine 20 times and have had a decrease of about 80% of the back pain that I have.
Imagine living without pain. These people have been given back their quality of life thanks to antalgic trak and the exclusive technique performed on it called KDM. Kinetic Decompression Mobilization. Introducing the technology of antalgic trak, utilizing the exclusive KDM therapy. Created after years of research and development, KDM is a safe and effective method for relieving spinal, nerve, and disc pain, as well as increasing spinal range of motion and improving essential spinal spacing. Antalgic trak uses sophisticated computer-guided actuators to provide graceful and gentle pulling forces through the spine. Antalgic Trak's range of motion guidance system strategically directs and moves these pull forces into, around, and through the spinal column to maximize the recovery. Non-surgical, FDA cleared, and innovative patented technology. The antalgic trak by Spinetronics and the exclusive KDM therapy. Antalgic trak is revolutionary. It offers the most complete power traction and decompression therapy available, capable of positioning a patient into more postures than any other device in the world. Capable of performing disc decompression in the neck or lower back, Antalgic trak has been designed to get faster and more improved results, above and beyond any other system available for treating spinal conditions. Developed by doctors and engineered to restore the spine's ranges of motion and provide a superb and gentle power traction that can rehabilitate spinal movements and decompress injured and compressed discs. People often wonder, what's the underlying cause to their back pain? Research shows that strenuous and repetitive activities in any area of the spine are precursors to injury. Spines with locked, fixated, or restricted vertebrae can also predispose the spine to injury. This view identifies a herniated disc, which for many is the cause of pain. As a disc becomes overloaded or squeezed, these extra pressures weaken the disc's outer cartilage border. Here, the soft inner gel of the disc has protruded through its outer cartilage border and onto the soft exposed nerve root. The weak outer border allows the inner disc gel to bulge or herniate through the outer cartilage border onto the neighboring nerve roots. This can cause excruciating spinal pains that may radiate into the arms or legs. Conversely, it may even cause numbness. The technology of antalgic trak and its unique and specialized KDM therapy allows you the opportunity to get the most advanced and gentle power traction therapy available in the world, reducing disc pressure, bulges, herniations, nerve root pressures, and pinched nerves. Antalgic trak is capable of targeting specific areas of the spine using a series of systematic and repetitive movements. These movements unpinch nerves and restore proper spinal movement and function. Antalgic trak also has the ability to position a patient into a pain-free posture prior to the treatment. The exclusive posturing helps shift the disc bulge or herniation away from the compressed nerve roots, making treatment comfortable and relaxing. Antalgic trak's exclusive articulation features enable your doctor to gently reposition the spine, making the pulling forces more effective. Here's how power traction decompresses a disc. Disc height is gradually increased by gently separating the vertebrae. The separation forces create a vacuum phenomenon within the disc to hydrate and draw in nourishing fluids without needles or drugs. Antalgic trak's exclusive range of motion system gives it the ability to accommodate each patient's specific condition, making it the world's most complete range of motion spinal power tractioning system in the world. From the moment you get onto the antalgic trak, you'll quickly see how comfortable, convenient, and patient-friendly it is. If you're in pain, if you're considering surgery and its risks, why not try this new technological, non-surgical approach? The new and innovative design features exclusive to antalgic trak make it a truly revolutionary breakthrough in the treatment and healing of chronic back and neck pain. Experience the sensation of antalgic trak's KDM therapy. Kinetic, decompression, mobilization. The antalgic trak is the gold standard for cervical and lumbar decompression. Nothing else comes close. This is true intelligent design. The most innovative and effective pieces of traction equipment. Improved and enhanced targeting of the injury site. This is a remarkably innovative way to better target the injured area. Now that you know about antalgic trak and its many features, it's time to call your local Antalgic Care Clinic and begin your recovery today. Antalgic Trak's exclusive Antalgic Care KDM treatment protocol allows you the opportunity to get the most advanced and gentle power traction therapy available in the world. Your Antalgic Care Clinic will provide all the necessary tools you'll need to educate yourself about kinetic decompression mobilization and the many wonderful benefits of the Antalgic Trak. Antalgic Care clinics are staffed by doctors that have been trained in power traction technology and the KDM protocol. These doctors offer you the finest in non-surgical spinal care. Now there is something you can do about your pain. It is safe, non-surgical, and may be the answer to all your back and neck problems. Antalgic Trak's Kinetic Decompression Mobilization Therapy, or KDM. Available only at Antalgic Care clinics across the country. Many Antalgic Care clinics offer free consultations. If transportation is an issue, some Antalgic Care facilities utilize transportation service. When you call, you'll speak to a dedicated professional that will answer all your questions and schedule an appointment to get started. Call a specialized Antalgic Care clinic today. For more information about Antalgic Trak and the Antalgic Care non-surgical clinics, use any one of our convenient methods.
Hello, I'm Dr. Bass, and I have Victoria Mallow here with me to help in a demonstration of the belting procedure for Antalgic Trak. To start with, I'd just like the viewer to notice that we have thoracic strapping and lumbar strapping. I'm going to start by putting on the thoracic strapping. It's a relatively simple process, and I'll just ask you, Victoria, to hold those pads right there.
Okay.
We go through the barrel lock. And if you could just turn your back to the camera, we want to make sure that the end pads are touching or an inch or so apart. Come on back around.
Okay.
Good. And that's fine. Now we'll put on the lumbar belting. And just hold those pads there. Good.
Okay.
Through the barrel lock again. Turn the back to the camera. Again, making sure these pads are even with the thoracic pads, just about touching. Come on back forward. Good.
Okay.
And now that they're on, we take the upper thoracic straps and just hold them over the shoulders. Good. And why don't you just hold them with one hand.
Got it.
And hold on to the table with your left hand. Step up and sit yourself down. Swing towards the front. Now in this posture, we would next want to elevate the seat bottom. It's the seat bottom that actually produces the pulling effects and forces of the traction decompression. Takes just a short moment.
Going up.
And this is all part of the setup for the decompression treatment. The next part of the setup is just taking these thoracic straps and slipping them through the thoracic latch clamps. Typically in a physician's office, there would be a staff member who would be helping to perform this setup. Now also to share the stress on the thoracic belting, we have these axillary supports that just make it a little more comfortable for the patient. And they're adjustable as well. That's good.
Feels good.
And then we put the front of the thoracic strap into the clamp. When you're experienced with the setup, it probably takes about 1 to 2 minutes. Then we attach the lumbar pelvic strap into its seat bottom latch clamp. And each of the belting systems have 4 clamps. And the success of any of the decompression systems is the effectiveness of its clamping and strapping. Okay, I've got all the clamps fairly snug.